Welcome to the Dietitian Business Podcast. I'm Maggy Doherty, your host, dietitian, and business coach. In today's session, we have a business coaching session with John Yuhas of Yuhas Nutrition out of Syracuse, New York. It was such a neat session where John came in asking, how do you navigate building a private practice while you have a part-time job, and how do you balance this work-life balance? We got into topics like hiring, client retention, and really spent a lot of time about how to work more on your business instead of in it through implementing deep work time, prioritization, and creating an awesome to-do list. You can't miss this episode if you have a side hustle, if you're trying to grow your business, or you're trying to work more on your business. This one's for you. So tell me a little bit about your practice and what you're hoping to get out of today.
Yes. Okay. So long story short, started up in 2024, and this is the year where I actually feel confident that things are moving. It is a lot of CKD, a lot of diabetes mixed in there. I do see a lot of Medicare Advantage folks, so that works out really well. I'm stationed, my office is out of a nephrology practice. I get referrals from that practice, the other practices in the Syracuse, New York area. And also, people find me on the insurance listings for, who's contracted with insurance. Those are fun ones. Don't have to put myself out there to get that info. The work's been done. And realistically, I think I do it like a day and a half, 2 days weekly. So yeah, I'm really comfortable putting those clients in those days. And from here, looks like I can expand. Should I expand? What should I do with my practice? Just knowing that I want to keep pretty firm boundaries between work life, home life. Um, I did do some evening clients starting out just to kind of offer that up. When it turned into like more than a day a week, and I was kind of going into the evening routine with the family, kind of found that it's great to know you're, earning money, but also you're kind of missing out on some big life stuff. So yeah, spend most of the time in the office. I do telehealth as well. I think the population I work with is more prone to enjoying that face to face. Not saying that there's yet any specific population that prefers it, but I think they like having the brick and mortar. The telehealth is definitely, I have clients doing that as well. Um, so that's kind of my practice.
Oh, hi. So you have your private part. Would you call it like your side hustle or part-time job, or like how would you kind of describe how much time it takes up in your
Yes.
life, business?
Fortunately, I can call it a side hustle. Um, I was full time last year, and I was kind of doing the building up the practice, getting the business situated. So in New York, my practice is set up as a PLLC, so I had to get like the New York separate licensure with the Department of Education, and then got the PLLC set up, and was doing that kind of casually, getting the contracts, and now realistically, yeah, part time, but I can kind of see it progressing. But also, if it's progressing for the sake of being able just to see more clients, um, versus like, am I actually getting a target population? Am I actually doing something that someone else isn't doing? So navigating how I can best be effective and also manage my time, because I do work in outpatient dialysis as it was the full-time job, and that's I've reduced in hours. But there's a lot to be said for having some structure like that during the week, whereas we kind of know in private practice, you're kind of spearheading things, and you can kind of make things fit into kind of the nooks and crannies. So yeah, I would say it's a nook and cranny practice right now. I have been able to expand more during the week into it, like reduce my other hours. Yeah.
Boy, it sounds like right now you're at I don't want to call it a crossroads, but you're at a opportunity where you're trying to navigate the time you spend with this part-time job at the dialysis clinic, your
Yes.
private practice kind of going from a side hustle to a real thing, while you balance those two with also your work-life balance, with also where can this company.
Right. Yes. Um, so I have that in my mind. The biggest thing that kind of happened recently was that I got life insurance situated, which was formerly a full-time benefit I had. So doing that, and what else did I get? I hopped on. Fortunately, like I had my wife's health insurance I could hop onto. So those things, like losing those benefits, honestly, kind of like it's one of those strings that was kind of attaching me to something. Um, so I know a lot of what I've done private practice wise is you leap into the deep end and you start swimming, you paddling, and if you don't know what you're doing initially, and then you just kind of pick a little bit up at a time. Um, and then if you have some semblance of what a day is going to look like, that's great. But I think I'm at the point now, a year or so, and not even a full year, really, in seeing clients that some things will come at me from like left field where at the end of a day it takes a while to kind of decompress and pull things together, but um it's some semblance of sanity now that I can kind of dig into what is this practice, what am I doing going forward. Yeah.
So when you kind of ask, what is this practice? I almost reframe it, or like re-ask, like, what do you want out of the practice?
Yeah.
And what do you want it to, like, what do you envision it looking like, being like?
Right down the years. So the short term, um I think I'm lucky to say it's past the point of like viability. Like I don't have to worry about, is this something like, do I have to worry about making ends meet kind of thing? So I have a good referral pipeline. I have some clients following up. It's a lot of like one and dones. I feel like with CKD, you have a client come in, get the information they need. I try to kind of let them know that ongoing follow-up can be really beneficial to kind of really cement some of these um, foundational principles with their diet. But having that being said, down the road, I really want to tackle, like chronic disease management, CKD in this area in different kind of avenues. The one-on-one sessions, if it's very effective, but also I'm one person. Um, there are other dietitians in the area seeing patients privately, but that's, I think I could say that I'm the one seeing like the kidney disease patients. Not that they're not, um, but what they'll do versus what I do, I think that chronic disease, kidney disease niche, I can really go forward with like group sessions, seminars. Even kind of looked into there's like a demo kitchen, kind of like you can kind of host a class there. Maybe I could set up like a impromptu studio, but the rental fees are pretty cheap. And like the culinary aspect of nutrition is something I might want to tackle. Because during a session you're thinking theoretically, but when you put that practical aspect in, I think that's a balance that's it's needed. Um, and without that, it makes the habits we try to enforce and kind of implement with our clients. It's hard to do without having that culinary cooking kind of mindset with it.
Yeah, there's definitely so much potential, and like, if you pivot from doing one-on-ones to group, you're leveraging your time, and you can also make more in that hour.
Mhm.
Unfortunately, those groups can be hard to build up and get to a spot where they're worth having. At
Yeah.
least in Texas, with our reimbursement rates, we typically need about 4 to 5 people to equal a one-on-one spot. And so
Yeah.
if there's less than 5 people in a group, then we're almost kind of losing money, because we could have
Yes.
just had a
In
one-on-one
that
spot. So
sense, yeah.
they're tricky, but there is a lot of potential there for
Right.
sure.
And that's gonna be a definitely one of those things where you kind of dig yourself a little bit of a hole. If like you said, if you had less less people in that session, um, if it turns out like, it's one times, two times, like you get the word spread. So the marketing aspect of that is something to be considered. But yeah, it's starting to practice. Like there's a lot of financial holes you kind of dig into, and the less I need to, um, yeah, dig in the red unnecessarily, the better off I feel the practice will be, just kind of looking at the numbers and things. Yeah.
Absolutely. I've always had a kind of like a frugal, minimalistic startup mindset where, it's relatively very inexpensive to get a private practice up and running that's virtual. The only cost you're going to have is your EMR, your Gmail, Microsoft email server
Yep.
platform, if you even do a paid version of it.
Right.
Your website, a couple other things here and there, but
Mhm.
it's easy to become profitable quickly, but it's also easy to spend a lot of money
Mhm.
trying to get there. So it's almost like, this one-on-one's working, you want to explore something else. But if you don't have to spend time or money to figure it out, then why would you pivot?
Yes. Yeah, and if something's working, why go against it? There's definitely something to be said for like the burden of one-on-one, like how many sessions can you do in a day? And it's like, I get this reimbursement from one session. What's to say I don't do 10 in a day, 12 in a day? I'm perfectly fine with the handful of people in a day. And then kind of if I book a little bit more, that kind of gives some wiggle room for cancellations. Um, but something that's kind of stretches my, I don't know, it mixes it up, like the group sessions or doing I haven't dug into, like, social media part of things. For one, I feel like I have a really, like, squirrel kind of mindset, like, "Oh, there's something shiny over here," you go down that rabbit hole, and by the time you get back, if you do, what have we gotten from that? But the, uh, putting content out is a solid idea. I feel like for myself, it may be a rabbit hole that I could best serve, like, have someone manage that for myself. Um, or just kind of right now, I'm kind of word of mouth. It's doctor referrals. Um, the population I'm trying to reach right now may not necessarily need that. I put the website together. If you're listening to this and you look at mine, that was me. So I think there's some parents.
Again, another way to save money as you're starting a practice is you build your own website, and it doesn't
Yes.
have to be the best website ever. And I
Yes.
took a look at your website, and it's got everything that needs to be on there. It's
Yes.
like got the basics, and
Yes.
it's good enough, and
Yes.
that's all you really need.
Yeah. So I wanted to make sure I had who I am, what I do, what I offer, how to contact me. Not much more because the busier you get, sometimes like, is that needed? And because I'm not putting out additional services or offerings, so it hits the point, and yeah, it's kind of you can go into a lot of different pathways with what you can do with the practice. I think one of the things I'm doing right now is thinking of like promotional material or kind of like the logo and implementing that on all my paperwork and things. That's fun. That's a fun thing that I don't that doesn't take up like that higher level thinking kind of stuff. It's asking people like, do you like this one versus that one? Um, so that yeah, there's fun stuff and there's stuff that like you have to stretch yourself. Um, sometimes it's best served like reaching out to someone like yourself to really hash things out, or learning the hard way of like, okay, there's a reason why there's people out there kind of helping people along with this. So
Yeah. Well, speaking of pathways and learning the hard way, you had a couple questions here that you wanted to ask. Do you want to go through some of those
sure.
questions? Do you want to go
What-
through your intake form, or where do you want to go with this to where you get some of your questions or where you're stuck?
Yeah, yeah. Um, Where I'm at is I have things going and I don't want to give it up to someone that's not me. Um, because I know what I'm doing. I've spoken this out, I've voiced to text of this, I've written stuff down, like processes and things, and I've had some good help along the way. But, a client calls me prospective or just one I've had already. I know exactly what I want to put out there, the energy, the information. the structure from that initial point of contact. And I also I'm working on boundaries better as far as like when you take a phone call. I mean, I feel like being a good like in session practitioner, like you kind of hash things out, you get to the bottom of things. That could be quick, that could take some time. So sometimes we end up on like a 30-minute phone call, just kind of seeing what you're all about versus like myself, I want to kind of get to the point and kind of get us to the session so we can really hash that out. But the other thing is like a lot of people haven't worked with a dietitian before. A lot of people don't know what that means, and they got referred to me, and they're like, "Who is this person?" Um, and there's some resistance there from the get-go. So you have to be warm, friendly, to the point, knowledgeable, but also myself, like I don't have to think about that. Like I can do that. So when you transfer those ideas and like have someone help you out, that's the trouble of like hiring someone that fits perfectly and there's never going to be a perfect fit. Um, Also depending how much you kind of spend on that, and is how high quality that is, and yeah. So giving up the reins to an extent on the admin part of things is something that could be definitely handy. But also if I think if like one head doesn't know what the other's doing, like you can kind of get out of sorts with things. And if you have two people doing different things in the same practice, there has to be some cohesive communication between the two. Um, in my head, keeping myself straight for the practice is possible. In life, it's not. It's nice to honestly go into this like um mindset of or the practice mindset, so I know what's going on. Um, so it's controlled chaos, and inviting someone else into that controlled chaos is, yeah, it takes some mental convincing.
Everyone's path in their private practice, how much they want to scale, how much they want to delegate, how much they want to spend is going to be different for each person. So it's not wrong to do everything. It's not wrong to stay small. It's not wrong to get big. But if you want to scale, you can't do everything and you won't be able to know how to do everything. And really the most difficult, dietitians were not taught anything about really management, or delegation or leadership. And essentially to create a business, you have to be replaceable. And if you are not replaceable and you're needed, it's not a viable business. Um, and but you may not want that. So the trick is when you start getting stretched thin, it's looking at, are these tasks that I'm doing, that these administrative tasks, filling up my cup or pouring my cup out and making me feel drained?
Yeah.
Are they taking me away from the work in a client? Would I rather be in a client session than answering this phone? And if I hire an admin for 20, 25, $30 an hour and I'm seeing a client for 100, 150 an hour, you're making a profit. And so there's that aspect, and you can find the right person and have a really good training policy and find the person who has your same values. And you can also find someone who doesn't have that and have a bad experience and lose some clients. So there's a lot of different ways that it can grow. It sounds like your business has gotten to a point where you can only you can only see so many clients in a week and you can only do so much before there's a glass ceiling. So if we filled your whole calendar up with clients, let's say max you make 150 a year, if we completely booked you out, and you will not make more than that unless you hire dietitians or hire an admin so you can see more clients or do groups so you kind of bring more money in. And so it's a little bit of a system where as you delegate, it's finding those things that, what could someone else do? And if someone did this, would I be happier or be able to make more money doing a higher revenue hourly task?
Yeah, exactly. Yeah, the more skilled, like actual dietitian kind of stuff versus, yeah. those items. And I think like in my head, um, you think so much like, you have to be like exactly the same as me, like dietitian with like my ideas, my mindset, my philosophy to really kind of put that forward. But it's kind of like it is yet more of like customer service, just like setting a point on the schedule and like the whole what do I offer thing. Um, I know I kind of like eh, kind of an open book to an extent. Like when you're taking clients in, especially like they find you on the website, the insurance coverage. Like I can do a lot of things if it's a really unique niche kind of thing. So I would can refer out to others, but there's not necessarily a blanket how I can help until we get to that session. So communicating how you train, yeah, um your admin, yeah, like the outreach coordinator or whatever you would call that. Um, I think I'm kind of more in my head about it, but also I'm so in depth in the sessions that I don't necessarily like give myself the time to reflect on that. So it's I think yeah, the reflection on it and actually doing something with it, do different things, and how much capacity we have to hire them on. And for me, it's like, how do I even set that up in my practice with I'm like a one person corporation. So when I put something else in there, I can have to rework the corporation and da da da. So it's probably not that tricky or difficult to do, but um, the visioning of like, yeah, like the leadership part of things, having someone employed under myself, that's like not I chose the positions I took as a dietitian to not necessarily be in management. But it is my practice, so that'd be a bit different than like you get like initiatives trickle down from the top and you kind of have to sell. So it would be my stuff. It would be just me to kind of sell those things. So those are that's what's going through my head with these things, and not necessarily who that would be, but I would say more of how do we get that done um, from the process perspective.
How do you on a process, how do you hire someone on?
Yeah, how you hire someone and how I have to if I need to. I guess I wouldn't even have to restructure my business because it's not necessarily like they're a partner. It would be employed under me as like a 1099 and what that would amount to be, taxes and things. So it's a couple layers of those little things I'm not comfortable with. As far as doing taxes, I did it. This was the first year I did it with my business, and that was like ripping a giant band-aid off. Now that I've done that, I understand it more. But that's like the 50 other things I've done for this practice where I haven't done it. Now I understand it. And then slowly, like, once you do it once, you kind of have an idea. So it's kind of maybe I'm in my head about it, but also don't have the time to really look at that. And numbers wise, client wise, through the week, I'm in a decent place where I do have a little bit of a backlog of referrals, but I've made up a lot of ground with that. And the other thing with that is I could honestly have someone hired on admin wise, so I could focus more on getting those initials to turn into follow up clients. Um, I think that I'm kind of so like I am present in my sessions. Um, and it's I think it's a tricky line between selling yourself versus like giving them that help that they need. Like selling yourself on follow-ups, like so not leaving like a cliffhanger, but more so like how do we kind of get that initial all that work you put into getting that client the referral, getting it all into your EMR. And that's a lot of work. I got it down so like the initial client paperwork, onboarding, everything, it's not that challenging now. But it would be nice to just have that client there, and then the follow-ups, it's such a easier practice because they know who you are, you know who they are. Um, so it's also kind of navigating what's how can I be most effective as a practitioner? What's that follow-up cycle look like? I know there's was it like the third party platforms where they have dietitians on, and they want you to do it week by week. Um, so there's a certain kind of client that benefits from that. It's not everyone. If you want to push someone into that, they have a choice to come see you. Um, so navigating that, like, I feel lucky to do what I do, and people come to me for the sessions that we do. So honoring that, but also like trying to see if we can. It's not a one-stop shop. It's not a doctor's office. We need to really workshop stuff to make these habits into um or these choices into habits, these habits into like a get that discipline going with things. So it's being able to kind of morph my mindset into that, holding off on the administrative end of things, or having that off my mind could be helpful, especially when I'm going through like in a day, like looking at my emails, looking at my itinerary for the day, and there's a lot of admin there, like follow up this client, call this one for possible follow up. Um, and I definitely like have laxed on those. I see those there. It's like, okay, that's not a pressing thing. Um, but those things add up. Um, I'll say fortunately, like I'm not that far into like making these processes up that I can't, um, completely like change it up or tweak it. So navigating what works best for me, my practice and everything, it's an ongoing kind of journey in what we do. Yeah.
I'm hearing three main themes from what you just shared. One, hey, how do you hire someone? How do you know you have the funds to hire someone? What do you do company structure wise? What do you have them do? How do you find the time to do that? Two, how to better retain clients, get more efficient in sessions. And third, the other theme I notice is it sounds like you are so busy working in your business and at your job that you don't spend any time thinking about your business or working on it. Because I can hear right now as you're just kind of having, I don't, just having this hour to like process. Like I can hear you're starting to connect these pieces where it sounds like you just haven't had the time to think about what you want your business to be, how you want it to work, how you make it work for you and not you work for it. And so the first thing I'd say is try to set aside at least 30 minutes a week, ideally an hour to work on your business. That means not seeing clients, not doing admin stuff, but looking at where you want it to grow, how many clients you want to see per week, how much money you want to make. In order for you to make the amount of money you want to make, how many clients you need to see. Let's say you want to make 200 grand. How many clients would you need to see per day, per week, per month? Okay, if it's 100 clients per week, you can't do that. So you would need to hire another dietitian or two to get to that number. So doing some financial work to see, hey, how much money do you need this business to make? As you think about your work-life balance, how many hours you want to spend in your business? Okay, let's say you want to spend 30 hours in it, but you need to see 30 hours of clients to get to your financial goal. Again, you have to sacrifice one or the other, make less money, or hire more dietitians in your practice to get to that 30. So I think that's a key part that you're missing in your business right now is like that reflection time because you have like your gears are turning. They haven't turned in a little bit because they've been so busy working.
Yeah, and it's one of those. I feel like it comes in waves where the initial building up the business, there was a lot of what you're talking about, the reflection, how what we're doing with our business, where we're going, and then when clients started trickling in the door, your attention kind of spans to that more so, and you kind of lay off on this. And I know I have a significant to-do list that I want to dig into. Um, of which, there's a million different things, but mine is like insurance contracts. Um, I'm kind of making that right now, like the extra ones, like case by case, if a client pops up and it's a great fit, we can kind of go down that pathway, but also those take some time. So that, yeah, the weekly kind of like reflections on the business and where that's at, where it's going. It does help. Like before the podcast, I did it's like a questionnaire of where I'm at, I think like honestly part of it's like philosophically with the business. What am I trying to do? What are the numbers look like? The ins, the outs, income, expenses, number of clients a month or a week, month. Um, and that is something that I do kind of think about, but like a formal way of navigating what those projections look like. Uh, I will say if it wasn't for like being my own business, I would honestly like hate that kind of like perspective on things. But it's like me in the driver's seat. It's not like a game or like an idea like let's hash this out what we can do, but it's yeah, me in the driver's seat, how I can kind of dictate the progression of this business in my life. What the one thing I kind of think of as we've been talking is it'd be nice to have a telehealth component where I have some days strictly telehealth, um for the selfish purpose of just like being able to kind of be home and like around more like it for like kids kind of stuff. Not that you're like I mean, they're busy days, but now that it's currently like summertime where I have like kids home, it's nice to have that. I mean, that 15-minute 20-minute break, you can kind of break off and do some family things. Whereas in office, a lot of people prefer it, but if I could kind of situate the days where the telehealth isn't um it's not just like squeezed in there, it's something I planned out. So that'd be something I like to kind of morph into too.
Have you done values work before?
Values?
Like identifying like your top 5 values in life?
I don't. Well, not specifically that practice. No. I would. Yeah.
It sounds like family is one of your values. And so it's like, hey, if I can take a day and structure it to be telehealth, so I get to honor this value of family and kind of maximize these little breaks and see my family. Awesome. That's going to make me feel more fulfilled. I'll link it in the show notes and send you after. But Brene Brown is a great psychologist and she does a lot of work on values and guilt and shame and things like that. And she has a values worksheet. I did it about a year and a half ago, and my 2 values were flexibility and freedom. Um, Flexibility, excuse me, no, I think it was freedom and family. And it was very eye-opening because I realized with my role at my group practice, I was not flexible. I was locked into either client sessions or meetings with my dietitians or leadership meetings, or kind of my whole day was scheduled out. So there was not flexibility. And there really wasn't much freedom anymore. I was like in a corporate position. And I was so tired at the end of my days that I wasn't excited to hang out with my daughter. I was exhausted and like not looking forward to it. And there was this big wake up call like, oh my gosh, my 2 most important values in my life, freedom and family. I'm going completely against those at this job right now, which is what made me take a step away and kind of restart this business where I have a lot more flexibility. I get to see my family a lot more. Um, and it sounds like that value thing could be helpful for you, just as you connected that, oh, I want more telehealth days so I can be at home and see my family.
Yes. Yeah, because the other positions I've had, it's that structure. Like I I do appreciate the structure in a day, but you also I do appreciate breaking up that structure too. It's more fun to have it build up and you kind of break at it, but still have the structure there. Um, so you have that to guide your days, but also in the way that I do for myself like that I kind of enjoy and I'm able to be more present. And which is also why I kind of basically mix my evening sessions, unless like it's like a once in a while, like not even like a whole evening, like one client's one evening every now and then. The I know there's a lot work out there now being done with like so like the third party like dietitians under these companies where I feel like people are doing like full day Saturdays and Sundays. I know I have like a colleague doing that like in that space where that's like life happening. Like I want to kind of keep those bounds. So during the weekends I have that solid. that kind of the guidelines, but having the implementing the telehealth where how that aligns with the values, that I think that'd be a good little practice to kind of do, to kind of assess that big picture, to put words to what is happening and the chaos of my brain with the practice.
Yeah. Yeah. So let's go back about that first topic about how to hire someone. It it sounds like right now we're in a spot where you could hire someone or you couldn't. Like there's a couple different directions you should go. The first thing I would do is it sounds like you have a to-do list. I would I would look at that to-do list and prioritize it into high, medium, and low. High meaning things that need to get done within 24 to 48 hours, or there's going to be a consequence to some sort.
Yeah.
Medium, you don't do any of the medium stuff until you've done all the high. Typically, there may be a deadline within like a week, or the consequence just may not be as severe as those heavier deadlines.
Yes.
Low priority things for me are typically fun. They typically don't have a deadline, don't have a consequence. It could be like making a social media post, things like that. So I would look at your do list and categorize them to high, medium, and low. And then as you look at those things, what are things only I could do versus what could I automate? What systems could I use to automate this task that I'm doing? Or three, what could I delegate? What could I outsource? What could I hire someone to do? And as you kind of look at that, it's like, okay, here's all the things I need to do right now. What can only I do? What can I spend some time and figure out how to automate? And what can I delegate?
Okay. It makes sense because I definitely have that in my like mind to be able to do that for sure. It's kind of like the go into the murky waters of haven't done that before and then just making it happen. Um, so yeah, I have the my to-do list process is also chaotic right now. Just in the summertime and everything. I do have have it in my mind the things that like in the next 1 to 2 days, like that kind of thing, like what I need to do. After that, it's kind of okay, all that gets blended together. Uh, so just having that process and like like the kind of the weekly reflection on things to see where that's at. Um, I feel like for me that may be like on a Wednesday or Thursday because midweek I feel like I hit my stride with getting the flow of things. On Monday, I honestly forget that I was a dietitian when I go to work, and then like something starts, like, I have a productive day, but it's where I left off the last week. It can be tough to kind of plan it. So a midweek check in, what's happening, what I can do better and automate and kind of get that to-do list more situated. So yeah, I'm totally gonna like take this. I've been using like the scribe kind of software stuff and kind of putting it in like some to-do list kind of planning stuff for myself. So I'm gonna totally selfishly use that with this and prioritize, look at what it says, and realistically kind of workshop that way. Um, I think that's the invention of scribe software has changed my life, and going into a practice at this time too, it's very helpful. So using that for myself, um, any which way I can automate those kind of things as well is handy. So there's also a question of, I mean, I can automate my own automations with like, you can do like AI agents to do some things, but you need a person to do a lot of things. There's and that's one of those like go down a rabbit hole of all these things you can do and automate where like a person would be able to kind of give you straight up feedback, and then you're kind of doing some AI work where you still have to put the mental effort into it. Um, if there's a way to kind of remove that mental effort that you and someone you can kind of, I mean, I think like trust is built. Um, it, so if you have someone hired on board that you can trust, you can kind of, give them some freedom and leeway on some things. Whereas if you do like a lot of AI kind of stuff, it's not completely like 100% there, and like the little things you're not catching can snowball. Um, yeah, I think that yeah, both useful in their own ways, but setting a process for myself to reflect, to do. and automate. Um, I think that's handy to move forward with.
Yeah, and set a calendar event or put on your EMR like a 1 hour time block on Wednesdays from 8 to 9 or 9 to 10 or over your
Yeah.
lunch break total one or like the end of the day, wherever you're
Yes.
most, whatever time of day you're most creative. Or I
Yes.
always love the idea of start with the most important thing. So you'd start Wednesday mornings with that. And I
Okay.
live and die by my EMR. If it is not in my EMR, I'm going to
Yes.
forget about it or not do it.
Yes.
And
Yeah, there's no
so
place
it's
to if that's not there.
yeah, and so then you can kinda also leverage time blocking and, like, planning out your day with your EMR, so I love doing that, but I put that on your calendar, and then
Yeah.
now you have your to-do list, high, medium, and low. Now you kind of have this deep work time, and before going to the deep work time, you already know what you're going to be working on. It
Yeah.
may not be the high priority thing because the high priority may be working in the business, but it could be
Yes.
that thing that's most important for you to think about, work on, develop.
Exactly, and I had like, having I feel like in a month or 2-month time, if I haven't had, like, a higher priority thing that advances my business, kinda see if we can rope that in, if that makes sense, like, being client focused day to day, absolutely, that's, like, gotta stay present with that, but if there's nothing driving it forward in a direction like you talked about, like, in line with my values, but also progression of the business, maybe I gotta look at that, and, how do you block off your what would you call that, like, block in your calendar? Because it's such a I feel like in my mind, kind of ambiguous because there's a lot to it, but just, like, business reflection, hour or something like that.
There's an expression or a term called deep work,
Yeah,
where like the
you mentioned that, yeah.
yeah, deep work by the philosophy's by Cal Newport.
Okay.
I'll send you the book after. I'll link in the show notes too. I put the here. But really, it's just like time that you are working on your business and not being interrupted by other things. So you can call it whatever you whatever you want. My
Right.
when I worked at my group practice and people had access to my calendar, I think I called it something like what was it? I think I put, like, personal appointment, just so, like,
Yeah,
nobody
yes.
would bother me during that hour. But you
Yeah.
get I love just business reflection time or business work or
Yes. Yeah, because my Google Calendar, we're in a, pretty, strong relationship right now. Yes. Yeah, and it helps everything else. I wanna say, like, if you're using iCal, try out Google Calendar. I'm sure there's other stuff out there, but, like, I integrated most of my stuff into it, and I can see color coded where I'm going and put that there. So I would need a little, like, one color for that. So, I swear I was quite disorganized before I started my practice, and out of necessity, I became, more kinda driven to kind of organize things, 'cause without it, it's just absolute chaos. For one, just the communication back and forth between my referral sources. If I don't look like I have, uh, order in my my practice, gotta keep that ship, built, and from there, it kinda trickled down. So that structure and, like, kinda incorporating things like this into that structure has been very, very helpful. And that's still a process. That count like, I used to kind of hate going into, like, the calendar beginning of the month and kinda workshopping that, but now it's less painful. And then by the time a week comes up, it's already in there for the most part. That's very helpful. So you can almost take out the thinking that week. Um, for just the sake of just, one, scheduling clients and knowing when that's happening, but those blocks and things. Yeah,
do you use Google Task?
I so I think so. I don't use Google Tax. I think we use the same EMR civil practice, and I have tasks through there. And I my one other colleague was saying something about like Outlook tasks, was I kind of hate that idea. Um, I'm just kind of opposed to it because it's not user friendly.
I'm gonna send you a link on how to set up Google Tasks because what I love about it is that it integrates with Google Calendar.
Yeah.
So what I have a lot of my dietitians do is we create that to-do list, the high, medium, and low.
Yes.
on Google Tasks. So you have 3 different ones. And then I also have people create to-do lists like personal or marketing, referrals, and kind of putting
Yes.
different
Yes.
categories. And you can add due dates in it. And so then it pops up on your calendar.
At that time, yeah.
I feel like that could be a helpful tool for you. I used to use it a ton. I really liked it. And then I realized, again, for me, everything works better on my simple practice. So I have like, not 100. I have like 20 calendar events, and I time block my whole day. Whatever I don't get to, I move to the next day and I put the highest priority one first.
Mhm.
I found that works best for me, but I did use Google Tasks for a while and have a lot of people who
Gotcha.
find it helpful.
Yeah, I feel like I have a good process for my, like, specific client tasks in simple practice, but there's a lot of ambiguity to the outside life. So I either put up, I think it's like a note on my phone or a note on my computer, and it's a whole like, where did I put that to-do list? I probably lost a lot of those. And if it's like a really important task, it would usually come to me. Uh, but yeah, to have something standardized, um, that I can access like right there, that can be handy.
Think that would help.
Yes.
I used to also have a paper to-do list, and I would have high, medium, and low, and then I had a
Yes.
column of future ideas, and it was like any business idea that I came up with, I'd like put it here to think about,
Yeah.
and then I lost the to-do list.
Yes. Yes.
And I'm like, all of my ideas are gone. And so that's another thing that I really like about Google Task is you can't forget it. It's organized, it integrates with your calendar. And so I think if you know your calendar's working for you, leverage that opposed to finding a whole nother system.
Yeah. Yeah. Okay. Yeah, because I got I'm on like a Google business page, or I have, yeah, Google business accounts. So I have a lot of Google integrations. But that one to like pop up on my calendar would be handy. Um, to see, yeah, it's like you reflect at one point and then you kind of set that up. It's not like it's there every day. And I feel like with a to-do list, I feel like constantly it adding and taking out, and I get sidetracked a lot. I don't, if anyone's out there listening and they know me, I get sidetracked.
And also being a business owner, we're doing client care, we're doing marketing, we're scheduling, we're doing administrative, we're billing. And so it's really easy to get scattered brain because when you are a solo practice owner like yourself, you're doing everything. And so if you don't have a to-do list, you end up seeing a client, submitting one claim, charting, emailing, oh shoot, I forgot to. And so we're kind of ping-ponging back and forth. And so what I really love about having a good to-do list and time blocking is when you focus on one task or category at a time, you're so much more effective versus when you bounce around, you forget stuff and then we just get drained. And so I always love telling my solo practice owners to time block. And so whether you do client care in the morning and marketing on Monday afternoons, client care all day Tuesday, Wednesday, you do billing in the morning, admin in the afternoon, and kind of planning, task batching your stuff by category, either by full day, half day, or like putting time blocks.
Yeah.
And then you'd feel a little bit less, not totally not scattered anymore, but less scattered when you have a plan and you have, again, that same structure and you kind of know where you're supposed to go versus if you think about those days where you just open up your computer and you go, it's like bing, 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 bing.
Yeah. Yeah, I feel like that there's like a build up too. Like you have so much going, and that day is just like you you go a million miles an hour in a million different directions, but having that direction, and consistency with the similar tasks can be really helpful to kind of the continuity. Because you work on something amidst a lot of other things, and you're not going to get like the follow through that you would if you just had that focus. I think right now I'm kind of in the like, I've backed off hours on my other position, put more into this, but also that's more clients, and um, it, the, I'm the one responsible. Like if there's like a rush of clients, it's me that did that. So reflecting before I set that up for myself, not like I think we've probably all done this. Like, ooh, you book a whole bunch of people one day, and you're like, okay, that's future me's problem, and then that that calendar day comes and you're like, what?
I do this.
Why did I do this?
Yes.
Which will have that. And I mean, that's kind of how I think we kind of earn our stripes at sometimes, but also being able to kind of, yeah, those really busy days and kind of implementing like the kind of a space to kind of breathe time. Like I don't kind of book that into things, but like I do it. Um, yeah, when it's been a kind of crazy day, like same day charting is a great thing to do, but if you kind of do too much, you gotta have that space to kind of like take a break. Yeah. Um, so there's a lot going on with the chaos of the practice.
There's a lot going on, and there's a lot of potential, and there's a lot of enthusiasm and motivation that's able to propel your practice forward. I think you just need to um almost kind of like horse blinders, have someone put some horse blinders on and get some systems to make your work more efficient. So I think between the to-do list, time blocking, and spending 1 hour a week really working on your business should kind of help you take that next step to get where you're going.
Right.
Speaking of next step, this was the fastest 50 minutes. I'd love to keep talking more. John, tell people where they can find you if they want to follow, check out your website.
Yes, it is now completely all on Yuhas Nutrition, Yuhas, yuhasnutrition.com. Thinking about spreading into social media, not that excited. I'll have my maybe my wife has more interest in the socials to steer that ship. But for now, yeah, find me on there. And if you're in the New York area, I have a lot of insurance contracts out there, so come find me. CKD nutrition, diabetes, just healthy living. So that's my kind of shtick.
I love it. Well, thank you for your energy and the chat today.